Hey guys, my name is Maria and I'm going to be showing you the lateral palpations for the hip. So to start off with, what we're going to do is we're going to find the iliac crest. So on the skeleton, it's really easy to find. It's just going to be right here. On your patient, you can have them standing, laying prone, or supine. So my patient is prone, and what you do is you start from the thinnest part of the waist, you start squeezing until you find the bone, and you should be able to just make an L shape with your hand, and that's when you know you have it. The other thing I'm going to do is show you guys the greater trochanter. And for showing purposes, I'm going to do it on the opposite side, but usually when you test it, you're going to stand on the side you're testing. So you just go down laterally and medially, and you're going to just use the palm of your hand since it's a sensitive area. To know if you have it or not, you pick up their feet and you just do like a windshield wiper motion, and you should feel the bone against your palm. With that, you also will have the trochanteric bursa, and you will be able to feel that whenever it's inflamed. Okay, so for our next palpation, we're going to find the tensor fascia latae, and that's referred to as the TFL. To start off with, you're going to go ahead and have your patient laying supine, and you're going to find their ASIS. From there, you're just going to move laterally slightly, and that is where it's going to be located due to it connecting to the ASIS. From there, we're going to go ahead and find the iliotibial band, which is referred to as the IT band. And it also just goes right off of the TFL and it moves down laterally the leg. Next, we're going to find the gluteus medius, and you're going to go ahead and find the greater trochanter again. If you can't find it, or you need to make sure your hand is where it should be, go ahead and move the leg in a windshield wiper motion again. And so from here, you're just going to move superiorly, and it's going to end right at the iliac crest. Hey guys, so we're going to go ahead and start on the posterior palpation. I'm going to go ahead and start off by showing you guys the PSIS, which stands for the posterior superior iliac spine. And so it's just going to be the bony knobs right here on the back. And on your patient, they're going to go ahead and lay prone. And you're just going to go ahead and find the iliac again, put your thumbs down, and then you should be able to find those bony problems pretty easy, especially when they're a thinner person. And if you just slightly move your thumbs, you'll be able to know you actually have the knobs. Next, we're going to do the mediasacral crest, which from there, you're just going to move inward. Go ahead and use the palm of your hand, because again, it's a sensitive area to most patients. And you're just going to move it down slightly, and that's where it's going to be located at.
Hi, I'm Alejandro, and I'm going to be taking you guys over the rest of the posterior palpations. And we are going to start with the sacroiliac joint. And I'm going to show you on the skeleton first, because it's easier to see. To find the sacroiliac joints, you're going to palpate the PSIS. And afterwards, you're going to run your thumbs medially, and you will feel a ridge, and that is going to be the joint. And on your patient, you're going to have them lying prone, and you're going to find the PSIS, as Maria showed you guys earlier. And then you're going to run your thumbs medially, and you should be able to feel a ridge right there. All right, now I'm going to be taking you guys over the gluteus maximus. And to palpate the gluteus maximus, you are going to find the median sacral crests, as Maria showed you guys earlier. And the gluteus maximus is going to run laterally and posteriorly along the buttock, and is going to be right over here. All right, now I'm going to show you guys how to palpate the ischial tuberosity and its bursa. So to find the ischial tuberosity, you are going to abduct the hip and flex the knee. And you are going to start palpating superiorly and work your way down until you find a bony prominence. That is going to be the ischial tuberosity. And its bursa is going to be right on top of the ischial tuberosity, and you will be able to palpate it if the bursa is inflamed. Over the sciatic nerve. And to find the sciatic nerve, you are going to palpate for the greater trochanter. And once you palpate it, you're going to hook your fingers and just dig in. And some patients will feel a tingling or numbness along their leg when you palpate it. And now we're going to palpate the hamstring muscle groups. The hamstring muscle group is going to originate at the ischial tuberosity, and is going to run along the posterior leg, and is going to insert at the distal knee.
Go.
Hi, I'm Alejandro, and I'm going to be taking you guys over the rest of the posterior palpations of the hip. And we're going to start by locating the SI joints. Sacroiliac joint.
Hi guys, My name is Maria, and I'm going to be showing you guys the lower. Nope, I already messed up. I'm going to start off with showing you guys where the. Okay, now we're going to go ahead and move on to the posterior palpations. So first off, I'm going to go ahead and find the posterior. Dang it! You see that whiteboard? I need. Hey guys, so we're going to go ahead and start off,
Bloopers.
Used to do bloopers, and now he's like, no.
I know, but bloopers if like after you mess up. Like if you're recording and you just happen to mess up and you get it.
He's like, stop it.
Are you rolling?